Monday, February 8th, 10:30 here in Hawaii, which means it's time for Spotlight Hawaii. I'm Ryan Kalei-Suji, joined by Yanji Denise. We thank you, all of you, for tuning in this morning and being a part of our conversation. A conversation this morning, Yanji, that will take us right back to the state capitol.
That's right. We are lucky enough to have Governor David Ige joining us this morning. We've got a lot to talk about on this Monday. We want to start off. Good morning, Governor. Thank you for being here. We want to start off with the news that broke on Friday and over the weekend about the prevalence of variants in our community, or the presence rather. What do we know in terms of how much, what the impact this could be for our community and how prevalent these strains are right now?
Yeah, right now, thank you so much, Yunji, and Ryan, thank you again for having me on again. We just want to make sure that people understand that it's not prevalent. We found the first couple of instances of the B117 variant here in the islands, and that's the one that is generally referred to as the UK variant. I just wanted to start by saying, our state laboratory is really on it. They were one of the very first state laboratories certified to be able to conduct COVID-19 testing. And they are one of the few state labs that are able to do the entire genome sequence. And so our surveillance system has been looking for variants pretty much since the summer. And we are, finally seeing that network pay off, and it has identified a few variants. We have the L452R variant, which has been associated with Denmark, which, the scientists are really studying and trying to understand. We've had 9 or 10 cases of that variant, although at this point in time, they don't believe that it spreads easier or is more virulent or more debilitating, at least at this point. But we are in conversations with state departments of health all across to talk about those. The UK variant, as we've heard, is definitely more transmissible. We had 2 confirmed cases, and I do want everyone to know that we continue to look for these variants so that we can stay on top of it. It does take a lot longer in terms of we have to do the entire genome sequence to identify these specific variants, but our State Department of Health laboratory has the capability and is doing those genomic sequences. And there were 4 samples that we thought was the variant. 2 of the 4 ended up being positive.
So now that we know that it is here and in the community, what is the next steps, I guess? What do we do moving forward? Because obviously we know that it's in the community, but it's not something that we can't combat. I mean, we can continue to encourage people to get the vaccine, but will you guys be doing more surveillance now, knowing that it's out there? What are sort of the steps now that we know that it is here in our community?
Well, Ryan, we will continue to do about the same amount of surveillance. It is a broad network. We're working with the private labs as well, and actually they're screening, and there are certain molecular elements that when they see in a COVID sample, does tell us about the UK variant. And they are searching for those markers and informing us as soon as we get them. So it's not so much that we see a need to increase the number of tests that we're doing. We think that the 300 samples that they are taking on a monthly basis is sufficient to identify the variants. I just want to remind people that the same public health actions that we all take, wearing masks, maintaining physical distance, washing your hands, staying home when you're sick, still applies for the variants. It's not that we have to do something different, but we would note that the UK variant is definitely more transmissible. And so if you're not wearing your mask, or if you're going to events with many people, then it won't be long before that becomes the dominant variant here in the islands. And then more people will get COVID if they're not taking the precautions.
Let's talk a little bit about the vaccine rollout and the numbers we're seeing from the federal government. Over the weekend, Joe Biden, during his Super Bowl interview, recommitted to getting this 100 million doses within the first 100 days. What are you seeing on the ground here in Hawaii? Are we going to be able to meet that goal? I don't necessarily know that you can project out to the country, but are you satisfied with the rate of vaccinations here in the islands?
Well, Yanji, I'm real satisfied with the fact that we do have a broad network of partners who is helping to administer. And as I said before, we could easily provide inoculations to twice the number of people that we are currently doing each week. And we are doing about 40,000. We get 30 to 40,000 doses every week, and we deliver them into arms. 30 to 40,000 each and every week. And so, we're not sitting on it. It's a pretty effective and efficient system we have. We're delivering directly to clinics, hospitals, and pharmacies the vaccine. So there's no middle leg, there's no middle person, and they are delivering it to people within that week. I hope they can increase production. As you know, President Biden has invoked the Defense Production Act, and that would allow them to scale hopefully much quicker. We do know that we would easily be able to administer twice the vaccine we're getting, and we could even expand beyond that if we knew we would get the vaccine doses on a regular basis.
When we talked to the Lieutenant Governor last week, he had mentioned that there may be some modifications coming to the Safe Travels program because of the vaccine for those who were able to get the vaccinations and prove that they did get them. We know that the last time we spoke with you, you had mentioned that you would be hesitant to make a move on that until the CDC comes out with some direct guidelines about traveling and vaccinations. Where do you stand right now on any changes that would happen to the Safe Travels program with those who have gotten the vaccine as more and more people in the community get them?
Ryan, we're at the same place. Even I saw an interview with Dr. Fauci over the weekend, and he says the same thing. Until the science tells us that those who are vaccinated cannot carry the virus, and I think most importantly, do not transmit it to other people, I think it would be irresponsible to say that those vaccinated can travel about freely. We continue to monitor the guidance. Even Dr. Fauci is saying, for those who are vaccinated to think that they can't carry it and then can't infect someone else. We just don't have the science that tells us that right now, and that those who are vaccinated should not be traveling, just like we're asking those who are not vaccinated to limit travel to only essential travel.
That, of course, is travel from the continent. What about inter-island travel? Do you see any restrictions on that changing in the near future?
Well, Yanji, we are seeing the steady decline in cases in all the counties. Today's count, even here on Oahu, has steadily declined. And as those numbers come down, we can relax travel restrictions inter-island as well. So again, I continue to talk with the mayors. There is some concern about the new variants, and we are carefully watching those. I mean, I do think that has heightened the whole notion about inter-island travel again. But I do think that all the mayors recognize that the more that we can get back to travel within the state, the quicker we can do that, I think the better it would be for our hotels and other travel industry partners to be able to at least encourage inter-island travel.
Sticking on that topic of travel, we're looking at some of the numbers that are coming out in the first few months from the Safe Travels program, and obviously hotels are reopening, and there are visitors that are coming to the islands, but they continue to struggle. Many hotels are saying that they are really just hanging on by a thread. Hawaiian Airlines made an announcement that they could be laying off as much as 800 workers in a few months if this continues. What can be done to help them to not only hold on to these employees, but keep this industry moving forward amidst all of that's going on and with restrictions that this Safe Travels program currently presents itself with?
Ryan, we are looking at vaccinating, right, all of our residents, and that's really important. And we wish we had twice as much vaccine as we're getting, but we're not. And that does help us. We've been working with HTA to be in communications with the hotels and asking them to prepare vaccination plans for their employees, the ones that do want to get vaccinated. We know that all of these things are essential and important to get done, and they do allow us to bring back more travelers. We do know that as more in our community get vaccinated, because of the effectiveness of the vaccines, we should see a reduction in the number of cases. And our recovery framework does allow for relaxing restrictions as the number of cases are reduced. So, we continue to monitor that and make adjustments in order to bring travelers back.
Ingrid Peterson has a question at 10:37. Do you support Green's idea of opening up after 1A and 1B vaccinations are done, even though we don't know yet that vaccinated people can still become contagious? The Lieutenant Governor did say that by the time 1A and 1B are finished, he thought it would be possible as early as May for large gatherings to resume. He cited the example of weddings, for instance. Do you agree with that assessment?
No, I mean, we're monitoring the virus activity, and the recovery plan does allow for relaxing of activities as the virus counts come. I think it would be irresponsible to say that people who, just because the numbers who are here, who are vaccinated, would allow for reopening of safe travels. I don't think that makes any good policy sense. We have been driven by the science and the public health advice that we get, and clearly the public health response at the highest level does not know yet whether those who are vaccinated can carry the disease and can infect others. And until we know that, I think it would be premature to bring back more travelers.
I want to switch gears. We know that the pandemic has impacted the economy as well. Many continue to be without work, filing for unemployment. Can you give us any update on where we're at with the unemployment benefits that have not gone out in this latest round of funding that came down from the federal government? We know that when we talked to the director over at the Department of Labor, saying that they're working on the mainframe and that it continues to be very fragile and they have to take their time, but yet many people are still struggling and waiting for those checks. Can you provide any update at where we're at right now and when people might be able to expect to see some of those benefits come through?
I think, Ryan, that's the most difficult challenge that we have. The fact that the UI system is so old and antiquated, and there is a concern that if it should crash, we would then take months to get it restarted and be able to deliver checks. And so, we don't want to rush and have the system crash and then have months and months and months before we can actually implement a recovery. So, I mean, I do know that it's difficult and many are struggling. We hope to get the rental and mortgage relief program up and running, and we're hoping that that would be helpful to keep people who have been unemployed at least in the apartments or the homes that they are currently in. I know that Congress is discussing and preparing to take action on the next COVID relief, and we are thankful that they've put a priority on that. And we do know that both House and Senate are really talking about a lot more resources and a lot more flexibility for states, and and that would be the greatest thing that we could have happen. And as you know, last week we did announce a partnership to implement improvements on the UI system. And I know that doesn't help people immediately with the old system, but we do anticipate before the end of the year that we would be able to implement a new modern UI system that should help these kinds of situations in the future.
Dennis Tanimoto has an interesting question that I was not aware of. The governor's 17th emergency proclamation expires on February 14th. When will a new proclamation be made? What can we expect out of the next proclamation?
We are actually working on that next proclamation as we speak. There are not going to be significant changes to that. As you know, the federal government is looking at extending the eviction moratorium on residential properties, and we continue to help support that, especially in light of the additional resources for rent and mortgage relief. And the new law does allow for direct payments to tenants in the event that a landlord refuses to accept the assistance. And I know that that's something, we had to turn away a couple of those applications with the last round because their landlords were unwilling to accept the payments from the government. So, we will be standing up those programs as quickly as we can. And we are hopeful that the federal government will take additional action to provide more relief. And we just ask people to be patient.
And so with those programs, right, the rent relief, the mortgage relief, what will that look like? Will it be similar to what we saw last time with nonprofits getting involved? We know that Catholic Charities and Aloha United Way played a part in that. Would that be something, again, that it'll be funneled that way, or would this be more the state handling it this time around?
Yes, Ryan, we have been working with the counties again, and part of the counties would be contracting with private sector partners, or some of them are really talking about being willing to do it, or rather doing it themselves. So, I think the most important focus is trying to get that money and that resources out to those who need it as quickly as possible. And we want to make sure, one of the things that became more confusing was when the state ran a statewide program and every county had individual programs. And we do know and have heard from those in need that it got confusing for them. So we're trying to consolidate that so that, depending on where you live, you would have one potential provider, and we can streamline the application and approval process.
There's a question here from Marianne. What about another restaurant card? That was a very creative solution to try to boost local restaurants and also help those who haven't been able to afford to eat out in a long time. Do you have any programs like that in the works right now?
Well, as you know, we did fund that program with CARES funds. And so we are hopeful that the Congress will take action. And actually, because of our success here, in the islands, I know that there has been talk about funding a similar kind of program and other small business assistance. We have heard from many small businesses who are struggling and having a real tough time just surviving. We are hopeful that this new aid package would include small business assistance, commercial lease assistance, as well as additional assistance like the restaurant card that can provide direct access and support to spending at our local restaurants.
You mentioned and you talk about this latest package that Congress is currently working through right now with the Biden administration. What do you know in terms of what that package will be able to support states in terms of overall funding? We know that, of course, the state faces some budget challenges ahead of this session, as well as going into next year as well. Do you think that there will be enough funding in there to help to fill some of the holes within the budget that would prevent things such as furloughs and other services that may have to get cut on the state level?
Yeah, Brian, we are definitely excited, at least when President Biden talked about the $1.9 trillion package. There was significant increase in direct aid to states, and they were talking about giving us the flexibility that we need, to be able to use it as revenue replacement to plug budget holes, And they are actually talking about the funds being used to help us with our budget crisis. So, as long as, I know that the devil's in the details and we have to see what the specific legislation provides. But it certainly sounds like there would be significant increase to the amount of funds made available. And most importantly, that they would provide a lot more flexibility than they did in the first package.
I want to go back to the vaccine distribution. We've gotten some questions here about teachers, and we know that some of them are starting to get the vaccine. Given the rate of the rollout, when do you expect that students who want to be learning in person will be able to have full access to that?
Well, Yanji, all of the schools are working with their communities. As you know, the virus activity on Kauai is significantly lower than other areas of the state. And I know that schools have returned to a lot of in-person learning, depending on how active the virus is in those communities. I do know, and we are collecting more data that shows that some students are just having a real difficult time learning online. And we want to at least focus on those most in need, those that are falling behind in their studies, and especially when it starts to impact graduation and when they might be able to complete the graduation requirements. So those are the priorities that we're looking at, the students who are falling behind, being able to return to in-person learning first. We do know that as we get more of the school personnel, and really it's more than just the teachers, it's all employees who work on a public school campus. And in addition, the vendors who would normally be involved would be priorities to get vaccinated. And as we get more vaccine and more of them get vaccinated, we know that the school would become less and less of an issue of spreading the virus to others.
We spoke with Mayor Blangiardi a few weeks back, and he talked about the concern heading into, of course, what we had this past weekend with Super Bowl and waiting to see how things pan out after those numbers. Hopefully, we won't see another surge because of gatherings that happen. And if he said if numbers continue to stay low, he was looking at adjusting the tier system and allowing businesses like bars to move up into the tier system, basically to where we're at now in tier 2 rather than wait till tier 4. He also talked about potentially allowing some form of sports to be allowed with youth. Would you support and approve something like that if that came across your desk with that request from the mayor?
We are working with the mayor, Ryan. We've, like I said, I do meet with the mayors on a regular basis. Both Rick and I have talked directly about that. We are looking at, and we've included the neighbor islands, as you know. Kauai youth activities has been restarted for about 6 months now, and so clearly, getting the knowledge and experience of what Derek Kawakami has done, and Mike Victorino on Maui has also restarted some of those youth league activities. So we do benefit from the lessons learned on the neighbor islands, and definitely Rick and I are talking about what we can do. Obviously, the numbers are headed in the right direction. We continue to see the decreases, and if we can get it below 50 on average for the 7-day weekly average, then we definitely would be in a better place to relax the restrictions in those areas. We continue to work with industry partners as well. I know that there's been a lot of different ways. We don't want to shut businesses down. We are trying to encourage the sharing of best practices amongst the restaurants and the bars. And I think most importantly, we're trying to really differentiate those businesses that have implemented and faithfully carry out the mitigation measures, making sure the tables are 6 feet apart, that everyone is masked, that all of the cleaning and sanitation routines are put in place, and trying to help those businesses stay open is something that both Rick and I want to do.
Want to ask just on a personal note, have you received the vaccine yet? And if not, do you know when you are in line, where you are in line rather?
No, I haven't received the vaccine yet, and I clearly am talking with Libby. You know, I'm glad to see that teachers and other frontline state and county employees have begun to get the vaccine, and certainly it seems like we're getting closer. You know, Yanji, if we get continue to get 30 to 40,000 vaccines a week, then you know it could be in the next week or two.
I want to shift our focus away from COVID for a few topics, if we can. We spoke last week about, we had a show here on our program about Aloha Stadium and where we're at. We spoke to Finance Chair Luke as well as Representative Johansson, who represents that district. There was some talk about what entity should be leading the charge here as we move forward with the plans for Aloha Stadium. Should it be the HCDA or the Stadium Authority? Do you have any thoughts on that, on what entity should be leading the charge, as well as you know, Representative Luke also said that she thinks that games can still be had at Aloha Stadium instead of moving things to UH and having to pay for the retrofitting of those facilities. Wanted to get your thoughts on Aloha Stadium and the plans moving forward.
Yeah, you know, Ryan, I've really been supportive that we ought to make the investments in repair and maintenance on Aloha Stadium. You know, I've been to events there. I think we've made significant investments to improve the current structure. I believe it's safe. You know, as you know, the attendance numbers have been dropping there, and there's a lot of things that we could do within the existing facility that would make it usable for the university for many, many years to come. And that would, in the overall scheme of things, cost us less in construction funds than we currently are talking about. You know, the biggest challenge right now is that a replacement stadium would cost $350 million or more. And that's really hard to take away from public schools and university needs, not to mention healthcare and health needs that we have here in the state. And that's the biggest challenge. You know, the current stadium is still safe and usable, and we ought to be maximizing the use of it. You know, as far as it goes with whether HCDA or the Stadium Authority should be doing the redevelopment, you know, I think we should be pursuing two tracks, right? We need to extend the life of the current stadium as long as we can, and take those actions to make it safe and usable. At the same time, we can pursue redevelopment. And you know, HCD has been involved with many redevelopment efforts. The stadium authority has not really been involved. And so, you know, either one I think is appropriate, but it's really the overall cost of the project that really gets to be daunting.
We're just getting so many questions about unemployment, and so I know our time is winding down. But I know we did address unemployment a little bit earlier in the program. But for folks who are just joining us or who really want to pin down some kind of a timeline, I know that it's hard to predict when these people will be receiving their benefits. But for those people who are waiting, what can you tell them about how much longer you expect them to have to wait?
Yeah, I'm sorry, Yanji, that we don't have a better answer from that. I mean, I did talk with Anne just because I knew that this question would be coming up. As I said, that is the most asked question I get here in the governor's office about those that have applied and have not gotten an answer back yet. And, you know, it's unfortunate that the system is just so old that it's very hard to predict when we would be able to complete the changes necessary. You know, these are new programs and there are new requirements that make it difficult. You know, these old systems just do not allow us to rush it, because if in fact the systems crash, that would really be devastating, and we would be unable to deliver services for a real long time. And that's something that we don't want to have happen. And so, you know, they are very cautious, and unfortunately, that's the system we have to live with.
All right, Governor, our time has come to an end, but I just also want to give you a quick opportunity to share any final thoughts that you may have as we close out here our conversation this morning.
Well, I just want to thank everyone again for making the personal sacrifices. We continue to see the decline in the number of cases that helps our overall community. We should be relaxing restrictions as the case counts come down. And I do want to assure the public that we are testing for the variants and we are monitoring, and we definitely want to be prepared. But we do know what actions reduces the spread of COVID, even the variants. And it is about wearing masks, washing your hands, staying home when you're sick, and maintaining physical distance, because all of those actions work on the variants as well as the basic COVID virus. And if we all continue to do those, then we will see continued reduction in the number of cases here. So thank you to everyone.
Thank you so much, Governor David Ige, joining us from his office at the state capitol this morning. Thank you.
Thank you.
Well, Ryan, interesting to hear from him, and we see all of your comments. We know that so many of you are frustrated, and the governor sounds like he's pretty frustrated too. The problem is that they just have this mainframe that is so antiquated. We've talked about it in the past, and it's just a matter of trying to update that system. So for those of you who are waiting for those PEUC claims, very, very tough right now. Next week, we will have the director of the department on to give us an update. That will be next week, Friday, and Pereira Estacquia will be joining us to take all of your questions, and hopefully she'll have some better news.
Yeah, and we also heard news from the unemployment office last week about them getting approval to find a new contractor that will build up and update this system so that it will, we won't see these delays. Unfortunately, that will take some time to get that system up and running and all the protocol that needs to be taken on that end as well. So that could be some time before that system gets into place. But good news on that front. The governor also mentioning that there will be some rental relief and mortgage relief that will also be rolled out in addition to these unemployment benefits. They're currently working with the different stakeholders involved to figure out the best mechanism to get that money out as well. So we'll continue to keep you posted on those programs as it gets rolled out here in the next few weeks.
Right. And turning to the vaccine, he said that Hawaii could administer twice the doses they're receiving. Right now, we're getting between 30 and 40,000 a week. We get notified every Thursday about what we're going to get the following week. Right now, that has not met our, abilities yet, but they're hoping that the federal rollout will increase so we can get more people vaccinated. Interesting to hear that he himself has not been vaccinated, even though you would think that he would be considered a frontline essential worker. So, but he did say that if the rate continues, he hopes in a week or two to be vaccinated himself.
Governor's waiting in line like many others here in the state to get his vaccine and his vaccination shot. He's also said that they are waiting to see what happens with this latest round of CARES Act funding and how that will impact the overall state budget to help fill some of the holes in the budget, but as well as provide some additional resources that can get out and make an immediate impact into the community. So we'll continue to see what happens in the next week or so as Congress takes on this $1.9 trillion plan by the Biden administration.
Of course, we are watching the vaccine rollout, and to talk about that with us on Wednesday, Dr. Melinda Ashton will be joining us. She, of course, represents Hawaii Pacific Health. We've had her on in the past, very, very knowledgeable, and we're looking forward to talking with her in more detail about the programs that they've set up in place across the state to make sure they reach as many people as possible, what to do in terms of how to sign up to get a vaccine, and also talking about these new variants.
Looking forward to that conversation. And then on Friday, we're going to be addressing one of the things that the governor spoke about. He said he's speaking to Mayor Blangiardi about as well, and that is allowing for sports to resume in some fashion for our keiki in our community. We'll hear from two individuals who have started an initiative, a safe sports program, in Chad Owens and Councilwoman Tupola, who will be speaking about their efforts to get that back online. We'll hear their thoughts and get your thoughts as well on that, on what should be allowed here as we move through COVID-19 in our community.
We thank you so much for starting your week off with us and spending part of your morning here. We'll see you right back here at 10:30 on Wednesday with Dr. Melinda Ashton.
Aloha.